Hi, my name is Samantha Smith, and I am a student at Bon Secours Memorial College of Nursing, and I will be giving my SBAR report. The patient is Vivian Knox, a 68-year-old female, admitted 4 days ago for a scheduled abdominal surgery for possible bowel obstruction that later revealed stage 3 cancer, colon cancer. Patient has been seen in the ED for stomach pain 3 times in the past 6 weeks and was diagnosed with diverticulitis, recommending a course of radiation chemotherapy to stop further spread of cancer. Patient was hospitalized 3 days ago and is now post-op 1 day. Vitals have a blood pressure of 140/80, heart rate 88, respiratory rate 24, temperature 98.9, O2 89 on room air. The patient is reporting a 4 out of 10 without movement, and with movement an 8 out of 10. Patient has no known allergies. She is NPO but can take sips of water only with her medications. States she has not been hungry all day long. She has an IV infusion going at 75 milliliters an hour of normal saline. She recently had a fully removed last night. She does have a PureWick in, and she's expressed having a feeling of nausea for the last 30 minutes. She has an NG tube running on intermittent suction, draining about 30 cc's of dark green liquid with no odor. Was given clozapine this morning at around 6 a.m. with orders to get up to the bathroom with PT and OT. With help with ambulation. She is very anxious about going home and is worried that her husband won't be able to keep up with her needs. She is unsure of how to care for her colostomy bag as well, and stated multiple occasions her fear for ambulating and getting hurt. Some abnormal labs, sodium was 145 to 132 within a day, amylase was 180, lipase going from 213 rising to 300. The patient is scheduled to have a CT this afternoon, and we're waiting on oncology consult. She does have a past medical history of her mother having colon cancer at the age of 67, father diagnosed with congestive heart failure at 56, sister diagnosed with right breast cancer at 62, and she is currently ongoing chemotherapy in the last month. She does have a daughter and grandchild that are alive, and her husband is frequently involved in her care. I do believe Mrs. Knox is a good candidate for Palliative Care. I would like to initiate a consult with them. The patient has expressed continuous pain, that possibly providing around-the-clock pain management would be a good recommendation. I think the family and the patient lack in communication as well. That can aid to the patient's goals of her treatment. I think having a group meeting involving the interprofessional team of her primary care, PT, OT, us, dietary, social worker, and the family. I think that needs to be conducted to come up with a plan. I know that she also mentioned she wants to look at advanced directives, so I think we should get in contact with her social worker for that. If you have any other questions, let me know.